Hello, so welcome back to Dan GH, and this is Anita. Today we are going to talk about the 10th station, which is evidence-based station. That is the last station aside the professional value station. So if you've watched my previous videos on professional value station, that is the 9th station. So evidence-based station is the 10th station. This station is a silent station. That means that it comes with a scenario and it comes with a research. Then you are given a sheet of paper to write your point. You write your name, you write your date, then you sign. So I apologize once again, as I did this video, uploaded it, but for some reason we might have mistakenly deleted it. But that's why we are here again remaking the video, and this time we are making it better and much more understandable. We are going to go by the marking criteria because that is like a skeleton that helps us to build our information on. It doesn't mean that once you have the marking criteria you have to vividly follow the marking criteria. The exam, we are all new to the exam. We haven't written the exam before. You are going to sit there and you are being approached with something you don't even understand. The midwifery OSCE is very different from what we've been writing in our home countries, and this is based on the UK standard. So how would you approach a situation when they bring it and you're like, I don't know what to write, or I don't even understand the research, or I don't even know where to pick my information from in the research? So what goes into it when you are given an evidence-based station? And under that we have place of birth, and we have induction of labor at 10. I might talk about this together, or I might talk about this separately, because they all talk about the same thing, and I'm literally talking about the skeleton of it, like how to fish your information from your research, how to fix your research into your write-up, and how to make the write-up more reasonable and more coherent. So stay tuned, and I hope you enjoy this session as well. And I apologize once again, and yeah, welcome back. So under the evidence-based station, which I mentioned earlier, we have place of birth marking criteria, and we have induction of labor. There are points that I am going to pick each and explain, and what is expected of you in each point. Our first point dives into summarize the main findings from the article summary and draw conclusion, making recommendation for practice. What does this point mean? Now you go to the exam hall, you are given a scenario about place of birth. So this can be, let's say, a woman who has had a cesarean section before, and she comes to you and she tells you that she wants a vaginal delivery. Nice. We're going to support you with a vaginal delivery because people have had a vaginal delivery before after cesarean section, so VBAC. But then she further moves on that she would like to have a home birth, or she would like to be in a midwifery-led unit, and she knows that she's a high risk. Now the tricky part is the scenario will come with she knows that she is at high risk, yeah, and she knows that she will need to be monitored, but she would like to have home birth, or she would like to be in a midwifery-led unit. Then you start to think, okay, this patient has much knowledge about her own situation. She knows she's a high risk, but why would she want a home birth? And why would she want a midwifery-led unit when she knows about it, that she needs to be in the hospital, needs to be monitored? And that's how the scenario comes. So it has literally tackled everything. It's not like they are going to tell you that she doesn't know, where you are now going to tell her that she's a high risk. So she tells you she knows, and that is where the trick comes. And then they buttress with what we call it, a research. And the research will talk about a pilot study that was done. It can be done by Royal College of Midwives, it can be done by Lancet Maternal, it can be done by the hospital, it can be done by the NHS, where they are talking about VBAC for home delivery, where they are talking about VBAC in hospitals, where they are talking about VBAC in midwifery. So a research that talks about so many things when it comes to VBAC. Then they give you the success rates and all those bits. So now you are supposed to fish out all this information and use it to advise the woman, and use it to also care for the woman. So that's how evidence-based practice is. So if you look at the NMC mock, it was talking about the OSCE technique, that is guarding the perineum to reduce third and fourth degree tear in women, and whereby this woman probably has had a tear before, has had a forceps delivery or a ventouse delivery, and would like her perineum to be guarded. So she wants to know that, and they will tell you that she wants to know that when her perineum is guarded, can she prevent a third or fourth degree tear? This is very broad. Like, at that point, are you going to say that yes, I can guarantee, or are you going to say that I can't guarantee? So they buttress it with a research which gives more information about OSCE techniques and the success rate, and basically that's it. So the first point being the main findings from the article and drawing conclusion and making recommendation. What comes in mind? Where are you fishing your information from the research? And this is what draws your mind to it, that if the scenario is talking about place of birth, and the mom, another key point is mom tells you that she wants, let's say, a hospital delivery. Now you have to look for the research, or the part of the research that is talking about hospital delivery, the number of people that did the hospital delivery, the success rate, and you join them together and summarize in simple sentence. I hope this makes sense. So based on the scenario and mom's choice, if mom wants OSCE technique, she wants her perineum guarded, which part of the research is talking about perineum protection, guarding the perineum, and which part of the research is talking about the number of people that participated, which part of the research is talking about the outcome of guarding the perineum? And that will be main findings, article summary, and drawing conclusion. That is how you have to pick your information from. Now I hope this is very clear, because you need to understand. If you don't understand, kindly please review the video and listen to everything I'm saying from the start. As I said, if you want to draw a summary, you have to draw the summary tailored to the information or the needs of the patient. You are given a scenario, you are given a research. In the scenario, what does the woman want? Whatever the woman wants, look for it in your research where they have stated the woman's needs in the research, and write your summary out of it. I hope it makes sense. Now the point 2, it says recognize the importance of building a respectful and trusting relationship. If you've watched my professional value videos, you will know what building a trusted relationship is and what involves when you want to build a trusted relationship. What comes in your mind when you want someone to respect you, when you want someone to trust you and give you more information. How do you communicate with such a patient? Give them that feeling of trust and relief to release all those information for you. That is what we call building a trusted relationship. So if you are writing your point, how would you build a trusted relationship? Simply write how you will build your trusted relationship with the patient. If you want more information on how to build a trusted relationship, I will advise you watch my professional value station, which talks about building professional and trusted relationship. We move on to point number 3, which says that provide clear, balanced information regarding all birthplaces in order to facilitate informed choice. Now, provide clear, balanced information. If you watch the professional value station, we talked about providing evidence-based information and giving them all the wide range, the leaflets, the barcodes, the digitals, where they can look out for credible information, because there are so many things on Google, there are so many things on the internet that may not be credible enough. So each hospital have like a leaflet that gives evidence-based information. So you, in the professional value station, you are talking about providing them with evidence-based information using leaflet, barcodes, stickers where they can scan and read more information. Now you've come to an evidence-based practice. You need to provide clear, balanced information. What will be your clear, balanced information? And this is the difference. With this particular one, you need to now go and fish that clear, balanced information, which is the research that has been given you. So professional value station doesn't have a research attached to it, so you gave a vague information that you providing leaflets and barcodes, evidence-based practice. Now the evidence-based station has arrived. You've been given an evidence-based research. You need to provide the information which is equally in the research. So the third point, providing a clear, balanced information, you actually have to state, you can phrase the research, you can quote the research, which is talking about the balanced information about the woman's place of birth. So this woman wants to deliver in the hospital, probably wants a pool bed, and she wants to have it in the hospital or be in a midwifery-led unit. What is the research talking about? What is the research saying about place of birth, that is delivering in the hospital? What does the research say about having a pool bed in the hospital? That is the information you need to pick out. So if it's saying that out of the 30 patients that had hospital delivery, 90% of them had pool bed, which was successful. So now you have that kind of information in your research. So all you need to do is paraphrase that research to create the same meaning. When you say paraphrase, it doesn't mean that you are changing the meaning. It just means that you are changing the grammar, how it is written, but has the same meaning. Or if you are very poor at paraphrasing, just quote the research that you are going to provide the clear, balanced information in quotes, that research, fix it in your write-up, and to aid the patient make an informed choice. I hope this makes sense. Your clear, balanced information, which is giving leaflets and all those bits. This time you are not giving a leaflet, you are giving a research which is already attached to the scenario. So your ability to fish that evidence-based information and adding to your write-up is what will score you for this point. So I will advise that you get the mock about OSI technique, which is the midwifery mock, the OSI technique, which has a scenario and it has a research attached to it. Try to create your own point using that research, just to give you more knowledge on how to fish out information from a research when they want you to talk about evidence-based practice. That is basically what it means. Then we move on to The next point, which is recognize individual circumstance relating to transition to parenthood, positive family attachment, and bonding. If we watch the professional value station, bonding was our last point, but this time is the fourth point. So it's basically the same thing. This time the woman has come to you. She wants to have a pool bed in the hospital, and she doesn't, all she knows is that pool bed is fun. She's probably has seen it on Instagram or social media, and she's seen people doing videos of pool bed, but she doesn't know that, okay, when she delivers the baby in the water, what happens next, what happens to her placenta. She doesn't have much information. Is she able to bond with her child? Will her child be breathing? So those things sometimes they may not have. But then again, you need to let the patient know, and you need to support them with it, with her choice. So even if her choice is not comfortable, like she's a woman with a raised BMI, which is a contraindication for pool bed, but she still insists she wants to have a pool bed in the water. And there is a research which is saying that people with raised BMI can have pool bed. Then a lot of things comes in mind, that how am I going to communicate with this person? Yes, this person can have positive parenting or positive parenthood even after she's delivered her baby. You need to narrate to her how the pool bed goes by. That is, once the baby is delivered in the water, mom picks baby up. We do not touch the baby, as it can stimulate the baby to start breathing in the water. Once you pick her up, we wrap you and baby together with towel, dry you clean, dry baby clean. If you want to commence breastfeeding, you can commence breastfeeding right after baby is out. It's still the same process as if you were to deliver on bed. So those are the differences. You still need to let them know that their style or choices of bed does not affect their bonding with their baby. I hope that also makes sense. So we move on to our fifth point, which is recognize the importance of advocating choice of bed, place, and work in partnership with the woman and multidisciplinarity. So we talked about advocacy in our professional values, where we say that letting the woman know that she is entitled to her right of care. That is, if she wants a pool bed, or if she wants a home bed, or if she wants a lotus bed, or she wants a home delivery, even VBAC. How are you going to advocate for such a woman? Some consultants will come and they'll be like, so you've had a cesarean session, so you are high risk, you need to be in the hospital, so we monitor you and all those bits. But then there is a research which is stating that you can have a home bed after VBAC in the hospital, and the success rate is high. And it comes with conditions which you have already discussed with the patient, and she has made an informed choice. It is now your choice, it is now your part or your role that you need to advocate for the woman when a multidisciplinary like that anesthetist come into play. The obstetrician comes to review the patient. She wants a home birth at the end of the day. What will she need a epidural for? If she needs a epidural, she can't have a home bed. So this is where you need to advocate for her, that she wants a home bed. She can't have a epidural. If she wants to have a epidural, she will need to be in the hospital. She's happy to take gas in it, or she's happy to go for hypnobirthing. So it will already be stated in the research where they are talking about certain pain reliefs, or where they are talking about obstetrician getting involved. So it's not like they are going to trick you by not fixing the information in. All you need to do is just read the research and pick out the information to draw your point, basically. So they are already talked about anesthesia or pain relief in the research, where they say that people who have home delivery use gas and air, and anesthesia epidural is not recommended. So advocacy is letting the woman know that, or supporting the woman with her choices, and if she has agreed to gas and air or even hypnobirthing, even when the anesthetists come over, you will need to kind of restate to them that this patient do not want epidural, or this patient do not want this, however she wants gas and air, or she wants hypnobirthing. I hope that makes sense. So advocacy is letting them know their right to care when you are in partnership with the multidisciplinary team. How do you support her, the woman, to stand firm with her decision, basically, and support her with her decision? Our last point, which is recognize that the woman should receive individualized care that promotes and optimizes normal physiological process. So recognizing individualized care. So the woman now has made a choice that she wants to be in a midwifery-led unit in the hospital. She is a VBAC. That means she's high risk, so she needs to be monitored. But then she wants a midwifery-led unit, and usually midwifery-led units are places which are more like free from obstetric staffs. It could be like there is no CTG, there is no newborn resuscitator, there is a pool, there is a washroom. It's more like they've created it like having your own apartment and wanting to have a home delivery. So it's created like a low risk room basically. But she's a high risk at the end of the day, and she needs to be cared for like a high risk patient. So how do you provide this individualized care? Now, providing the individualized care, she wanting to have a midwifery-led unit, you can still support her that this is a midwifery-led unit. You are going to be treated like low risk. However, your baby needs to be monitored because your uterus has a scar. Now, all these things I'm saying, there is a research which probably would have already talked about it in the scenario. So if she's going to provide individualized care, which part of the research is diving more into individualized care, whereby woman is being supported? Let's say she wants a pool bed, or a low risk room, or a midwifery-led room. Then the research is talking about women who have midwifery-led, have CTG, or women who have pool bed, have a waterproof CTG Doppler, which is attached to their belly and listen to baby's heart rate, and that it is not probably connected to a central system, and doctors will need to come in, or it can be reviewed by a midwife only. There will always be something that is supporting mom's need that you can fish it out and add it to your information to say that this is the individualized care that you are going to support your woman with. We have come to the end of evidence-based practice. What I want to tell you is that with the evidence-based practice, the point under respectful relationship, communication, individualized care, continuity of care, bonding, all those information in a professional value stage, you would have just said them how you would have done it. But this time you have been given the research where you need to fish all those evidence-based information you said you will provide. The continuity of care you said you provide, you need to fish it out of the research and use it and write it in your note. Then the examiner knows that you know how to fish evidence-based information. Just like when we're in the hospital setting and a patient comes and she wants VBAC, you go and you look out for leaflets which is talking about VBAC, and you explain to them this is the risks, this is the support that midwife gives to patient, this is the success rate, this and that and that. This time they have given it to you during the exam hall. So how do you fish the information? That is basically all. Now we will move on to induction of labor. And so I'm going to merge this video together because it's basically the same thing. So induction of labor, you will equally be given a scenario and you will be given a research which is talking about induction of labor. For example, let's say that this woman is not even diabetic. She probably had raised blood pressure at the latter part of her pregnancy and she needs to be induced, and she tells you that she knows that she needs to be induced. However, she wished to have, let's say, only the gel, the propels or the prostin gel, and she doesn't want to have her membranes ruptured, although she knows that rupturing of membranes is part of induction of labor process, or commencing oxytocin hormone is part of induction of labor process. She knows it, but then she tells you that she wants to have only the gel as a form of induction process. So there will be a research which is talking about women who have only prostin as a form of induction process and the success rate. So it's always looking at the scenario. What is it saying about the scenario? The scenario is always going to talk about what the woman wants in the scenario. Then the research will buttress the woman's choices. So it is your job to fish out all those information that is talking about the woman's choices and using it to write your report. That is all about evidence-based practice. I hope this video has been super helpful, and if you have any question, please look at the comments section box and we'll be happy to reply you. It may be difficult sometimes trying to reply some people, and the reply can come very late, which I sincerely apologize. But if you have any question, please comment in the comment box. We'll be happy to reply you and get back to you as soon as we can. Thank you so much for enjoying this video as well, and I hope it has equally been successful. Enjoy the rest of your day. Bye.